Sorry, everybody. I just realized that I think I might have been on mute that entire time, so let me start over. I apologize. Welcome to today's mini webinar on the Rare Disease Advancement Research and Education Act of 2018. Your audio was muted when you joined the call, and apparently so was mine. Questions can be submitted via the question box on your screen. The session will last approximately 15 minutes, including time for Q&A after the presentation. This webinar will be recorded and available on our YouTube channel. Effective advocacy is essential to ensuring the health, safety, and enhanced quality of life for those affected by Prader-Willi syndrome. As such, PWSA USA is committed to informing the PWS community of critical public policy issues to leverage the power of grassroots supporters to enact change. Because Prader-Willi syndrome is considered a rare disease, extra effort is needed to raise awareness amongst public and elected officials and guarantee the passage of legislation and regulations that help our community and defeat those that do not. I'm going to go through the next few slides quickly, but don't feel like you need to take notes. After the webinar, you will be provided with a copy of this presentation, key talking points, and a recording of the webinar. First, we'll cover a little bit about rare disease research and funding, more about the RARE Act of 2018, and what you can do to advocate for the passage of this legislation. So let's get started. Before we talk about the bill itself, let's talk a little bit more about rare diseases. There are more than 7,000 rare disorders that together affect more than 30 million Americans and their families. Approximately 50% of the people affected by rare diseases are children, and 30% of those children will not live to see their 5th birthday. This estimate has been used by the rare disease community for several decades to highlight that while individual diseases may be rare, the total number of people with a rare disease is large. In the United States, only a few types of rare diseases are tracked when a person is diagnosed. These include certain infectious diseases, birth defects, and cancers. It also includes the diseases on state newborn screening tests. As a sidebar, we did a webinar on Newborn Screening Reauthorization Act on Monday, and you can check it out on our YouTube channel some other time. Because most rare diseases are not tracked, it's hard to determine the exact number of rare diseases or how many people are affected. There are many different causes of rare diseases. The majority are thought to be genetic, directly caused by changes in genes or chromosomes. In some cases, genetic changes that cause diseases are passed from one generation to the next. In other cases, they occur randomly in a person who is the first in the family to be diagnosed, which is the case with many families who have a child with Prader-Willi syndrome. Many rare diseases, including infections, some rare cancers, and some autoimmune diseases, are not inherited. While researchers are learning more each year, the exact cause of many rare diseases is still unknown. In the United States, a rare disease is defined as a condition that affects fewer than 200,000 people in the U.S. This definition was created by Congress in the Orphan Drug Act of 1983. Rare diseases became known as orphan diseases because drug companies were not interested in adopting them to develop treatments. The Orphan Drug Act created financial incentives to encourage companies to develop new drugs for rare diseases. This definition was needed to establish which conditions would qualify for the new incentive program. The National Institute of Health supports research to improve the health of people with rare diseases. Many of the 27 institutes and centers at the NIH fund medical research for rare diseases. One of these centers, the National Center for Advancing Translational Sciences, focuses on getting new cures and treatments for all patients more quickly. They support research through collaborative projects to study common themes and causes of related diseases. This approach aims to speed the development of treatments that will eventually serve both rare and common diseases. Efforts to improve and bring to market treatments for rare diseases are coordinated by the Food and Drug Administration, or the FDA. The Office of Orphan Product Development, or the OOPD, provides incentives for drug companies to develop treatments for rare diseases. Between 1973 and 1983, fewer than 10 treatments for rare diseases were approved. Since 1983, the OOPD program has developed and brought to market more than 400 drugs and biologic products for rare diseases. Researchers have made progress in learning how to diagnose, treat, and even prevent a variety of rare diseases because of this. However, there is still much work to be done because most rare diseases do not have a treatment. So let's talk a little bit more about the RARE Act itself. The Rare Disease Advancement Research and Education Act of 2018 would provide much-needed investment in rare disease research. It would direct the Centers for Disease Control and Prevention to increase efforts to track and quantify rare diseases, and it would require the Agency for Healthcare Research and Quality to implement rare disease outreach and awareness campaigns for physicians. The bill would also commission additional analysis and recommendations from the National Academy of Sciences on how to accelerate rare disease therapeutic development. This is one of the sponsors of the bill, Representative Brian Costello from Pennsylvania. So you're probably wondering why there's only one bill currently. Each of the two sides of Congress, the House and the Senate, operate separately as bills are introduced by individuals in each of the two chambers. The person or persons introducing the bills are called sponsors. Representatives introduce House bills designated by the letters HR for House Resolution, and senators introduce Senate bills designated by the letter S before the number of the bill. In the case of the RARE Act, the House has introduced the initial bill. It's important to note that the bill in the House has two sponsors, a Democrat and a Republican, so it is truly bipartisan. Representative Andre Carson of Indiana and Representative Brian Costello of Pennsylvania chose to introduce the proposed legislation on Rare Disease Day, a day when rare disease patients and advocates around the world come together to raise awareness for rare conditions. Currently, there is not a companion bill for the RARE Act in the Senate. In addition to the original sponsors in the House, senators can show their support by introducing a companion bill in the Senate. By doing so, senators can demonstrate their support for the rare disease community and rare disease research. We need at least two senators to sponsor this bill in the Senate because having a companion bill is one measure of the likelihood of a bill being passed when it is brought to a vote. This particular bill is very important to the PWS community because each of the provisions within the bill would be a substantial benefit to the PWS patient community. First, the legislation would greatly increase the funding authorization for Rare Disease Clinical Research Network, or the RDCRN, which is administered by the National Center for Advancing Translational Sciences within the National Institutes of Health. The RDCRN represents one of the most robust and collaborative research networks dedicated to rare diseases in the world. However, the program is only open to a small number of diseases due to funding limitations. This bill, the RARE Act, would help address this problem by authorizing additional funding, which is very sorely needed. This legislation would also increase the understanding of rare diseases, including PWS, by requiring the CDC to create a national rare disease or condition surveillance system. This system would track and quantify rare diseases in the U.S. in order to facilitate research, development, and treatment for rare disease patients. This legislation would require the Agency for Healthcare Research and Quality to expand its efforts in educating our nation's physicians on rare diseases. The physician community is generally unaware of PWS, and significant additional outreach is needed to better equip our physicians to treat PWS patient populations. Finally, this bill would require the National Academy of Sciences to update its 2010 report on the state of rare disease therapeutic development and put forward new recommendations within the next several years. Given that 95% of rare disease patients are still waiting for their first treatment approved by the Food and Drug Administration, these recommendations are badly needed. Now that you know a little bit more about rare diseases and rare disease research and where we are now with the RARE Act, let's talk about how you can advocate for its passage on behalf of the PWS community. The first thing you can do is send an email or physical mail to your senators and representatives. Your email or letter should be about 1 page long, and it should only address a single topic or issue rather than a variety of issues you may feel passionate about. A typed 1-page letter is best. A physical letter is more likely to be read than an email, and you can typically find an email or feedback web form on the mailing or the mailing address on the elected official's website. Sending an email to an actual person is far better than using a website form, so if you can find the email, that's the best. If you have trouble finding an email or physical address, call me at the office and I'll try and help you find one. Make sure that your letter is legible and try to make it stand out by including pictures or bright colors to make sure it gets attention and leaves an impact. If you're sending an email, however, don't include any attachments because it may get caught in the spam filter to the staffer who's going to be reading it. Keep your letter or your email brief, polite, and free of grammatical errors. You're probably wondering if social media can make a difference, and it can. Social media is a very public way to show your support or opposition to the policies or actions of your representatives. Not every elected official uses social media, but the ones that do are easily found by visiting their official websites. When posting on social media, make sure that you tag their official page. Include a picture, as it increases the likelihood that others will read the text that goes along with it. Make it clear you are a constituent of the elected official, and make the post personal. Be aware that anything you post on social media can be visible to the public. You can also make a phone call to your elected officials. It takes less than 5 minutes and is one of the most effective ways to advocate. Staff are dedicated to answering your phone calls, and every call matters. Phone calls require minimal time commitment and no traveling from you. Every elected official will have a public telephone number that constituents can call to leave feedback. This could either be a place where you leave a voicemail or talk with a staff member. Only call your own elected officials and clearly state the address at which you are registered to vote so they know that you are a constituent. Clearly tell the staffer what you want the elected official to do, why it is important, and why you feel motivated to call. Stay polite with the staffer on the phone, but be firm in your interaction because it will be short. You can also attend a town hall meeting. Attending a town hall meeting is a chance to meet with your representative and get updates on what they've been doing. They're usually held in a public setting and are free to attend. Town halls provide fantastic opportunities to gain face-to-face access with your elected officials. To find out when town hall meetings will be held, monitor your elected officials' website and social media pages, sign up for their email alerts, or call their office for event updates. A lot of senators and representatives right now are moving their town halls to a virtual format. In a typical town hall meeting, your elected official will speak for about 15 to 30 minutes about activities in Washington. Then they will open the floor to questions from constituents. Raise your hand immediately when they ask for questions. The longer you wait, the more competition you will have for the microphone. This is your opportunity to ask about an issue or piece of legislation. In this case, you're going to want to talk to them about the RARE Act. Make sure you have what you're going to say prepared in advance. You may be only given less than a minute to pose your question. So prepare a short summary of the bill or issue you are advocating for. Be sure to introduce yourself, state the bill number, title, summary, and what position you are advocating for and why. Your summary and explainer should be no longer than 1 page. You should only address one issue or bill at a time. If you aren't given the chance to ask your question during the meeting, stick around afterwards and find a staff member. They can take your comments, answer questions, or refer you to other staff members if needed. Don't forget to network with other attendees while you're there. It's a great way to get other people involved in the PWS community. It's also recommended to bring a business card or a printed letter about your issue to help your elected official follow up with you. You can also schedule a meeting to visit with your local district office. It takes some planning, but it makes the most impact. You'll have a chance to sit down with a staff member from your local district office or maybe even talk directly with your elected official. In order to schedule a meeting, just visit the website of the person you want to meet with. You should be able to find contact information for their scheduler or chief of staff, or you will find a section of their website called Request a Meeting. If there is a web form to request a meeting, fill it out and someone will get back to you. Most state elected officials have district offices that are near your home address. You can ask to meet the elected official or a member of their staff in the district office so there's less travel involved. If you're working with a chapter or another group, it's a good idea to request the meeting be held at a local library or a town hall or another local venue to accommodate the size of your group. I really recommend going with a group of people because the more people that are present at the meeting, the more amplified your message will be. You can expect to spend about 10 to 15 minutes with your elected official, and it's not uncommon for elected officials to have legislative assistants or staffers hold the meeting instead. While the elected official may not be able to give you a lot of time during a meeting, their staff are in better positions to dedicate more time to hear your position and address your questions and concerns. When you're meeting with them, be sure to introduce yourselves and make a short statement about your position, your ask, your personal story, and why you came to meet with them. Be clear with what you are asking the person you're meeting with to do. If you're asking a senator to sponsor the companion bill in the Senate, make sure that you say that in your meeting with them. Stick to the issue you asked to discuss. If the conversation goes off topic, just bring it back to the reason why you came, and don't be afraid to press the staffer or elected official for a definitive answer or position statement in support of the RARE Act. Ask if the elected official will pose for a photo with your group, and if all members have been given permission to be photographed, share it all over social media. You'll want to thank your elected representative or their staff for their meeting and thank them for supporting the PWS community. PWSA USA also has prepared boilerplate text and templates for you to use, but we encourage you to personalize your emails, tweets, and calls and letters using these templates. These templates are more of a guide to help you make the point that you want to make and use your own words to add your personal perspective. Thanks for attending. If you have any questions, feel free to submit them via the question box on your screen. While you're typing out your questions, I want to remind everyone that PWSA USA is a 501c3 organization. So when you're meeting with your representatives on behalf of PWSA USA, keep in mind you're not lobbying, you're educating your legislators about the issues that are important to you. This is so we don't jeopardize our tax-exempt status. So keep typing out any questions, and I also want to take a moment to encourage everyone to register to vote. Check your voter registration status and turn up at the polls this November. When we talk to our elected officials, we want to be able to say that 100% of the PWS community votes. If you need help finding out about your voter registration deadlines in your state or voting times and locations, whether you're even eligible to register to vote, give me a call and I'll help you through the process. So with that, let's see if we have any questions. It doesn't look like we have any questions, but if you do have one after we end our webinar today, just shoot me an email at alucy@pwsausa.org, or you can also reach out to us on our website, pwsausa.org, or email info@pwsausa.org. Thank you, everybody, and have a happy Wednesday.